Good morning, everybody. Today we have with us Dr. Atul Shah from Mumbai, who is a pioneer in Indian flower remedies, and we would like to know his journey. Thank you, Dr. Shah, for joining us.
Thank you.
So, I understand you are a radiologist by profession originally. Can you tell us a little bit about yourself, how you began your journey, and where it has led to today?
Sure. Basically, I'm 74 years now, and for last 41 years, I'm practicing what is called as a bioenergy remedies. Me and my wife, we are the pioneer in the world for Indian flower remedies. I was practicing in Sloan Kettering Hospital in New York and learning about MRI, magnetic resonance. I did specialty into neuro MRI. And then suddenly I decided to go back to India. And then this is what I am here for last 41 years. I'm practicing Indian flower remedy. It's also called as a bioenergy remedies. And these are energy remedies and not chemical based remedies.
Okay. So, how did you develop an interest in this bioenergy healing?
It's a long story, but cutting short, I met my wife, Dr. Rupa Shah, and she talked about the flower remedies, which is called as a Bach flower remedy, BACH, Bach flower remedies from England.
Mhm.
It is an English flower remedy. And Dr. Bach was also MD pathologist, and he developed these remedies called as a Bach flower remedies. I decided to work on Indian flower remedies, and that is how I have developed all these different type of it, and we have made almost like 12,500 combinations of
Fantastic.
flower remedies.
So, what is the difference between Bach's flower remedies and Indian flower remedies?
One thing, first thing is that Bach flower is English flower remedies.
Okay.
Okay, there are many people in the world who are doing different flower remedies from different countries.
Mm-hmm.
Okay, we decided to develop Indian Himalayan flower remedies.
Mm-hmm.
Okay, and we have a special technique
Mm-hmm.
where we don't cut the flowers. We are just transferring the healing energy of the flower, and it's a healing and living energy. Very important point. A good number of people cut the flowers, so the
Mhm.
living energy is gone.
Okay.
But in our case, we have a healing and living energies of the flower, which we put it into the water, whatever the base of it may be, water, oil, powder, cream. So that is what we are doing it. And then we have gone all the way from like Bach flower remedy was known earlier, mainly for the mental and emotional problems. But because of our medical field for last 41 years we have grown, so we are now able to treat at a physical level, emotional level, mental level, and spiritual level. Okay, that's one thing. And in physical level, we are able to now address the epigenetic and genetic problem also
Fantastic. Using the Indian flower remedies.
using the Indian flower remedies.
So, if you are going to target these different areas in one particular person, would you be using just the one flower remedy, or is it a combination of techniques? Or
Okay, we started with single flower remedies,
Mhm.
and till today the most popular flower remedy is a lotus flower remedy. Indian lotus flower remedy is very well all over known in the world. We we are most of the time using the combinations of flower.
No.
Okay, that is a special technique how to make the combination. Which flower should be first and which should be what is the quantity of the flower, how many drops we are putting it. So these are the things which we have to keep in mind. In fact, while choosing the flower remedies, I mean flowers, before making the flower remedy, we also see the direction of the flower, in which direction it is. So, combining our Ayurvedic knowledge, and we can choose that whether the flower was from northeast side or north side or south side.
Right.
Accordingly, we know the effect of on the human being.
That benefits.
And successfully, because this is energy-based remedy, in repeating this, that we are not only treating human beings, but we are preventing the disease in human beings. Okay, then we are gone into the beauty part of this thing. We are treating the animals.
Okay.
Okay, very very successfully. So that is actually easy to treat because then there is no other factors which in human beings come in the way.
Mhm.
Then we decided, and we are now very successfully able to treat on an agriculture base.
Oh,
So it's a
fantastic.
pest repellent and not pesticide.
Mhm.
Uh, Fertilizer and nutrition for the soil.
Fantastic.
Yeah. So this is one thing.
So it's
So
got
this,
across the board applications.
this is just halfway. I've told you.
Mhm.
This is the living things we are talking of.
Mhm.
Human beings, animal, and plants.
Mhm.
I have done in non-living things because it is an energy.
Mhm.
I have modified petrol, diesel,
Mm.
wine, whiskey, bread, biscuits,
Okay.
beans.
All right.
Yeah.
Very interesting.
Yeah. So even for simple example like paint, we have put the flower remedy in the paints. So suppose your bedroom is there. If you put that flower remedy into the paint, then you have a calming effect. You have better sleep,
Mhm.
and you want good harmony. Then it's your drawing room where
Mhm.
you are sitting. So we put that harmony remedy in the
Fantastic.
paint, and you get good harmony in that area. For kitchen, good, positive, healthy vibrations of cooking food. So we put that paint, that type of thing. So this just give you example like that. Uh, of course, I've been very successful in modifying the petrol molecule,
Mm.
diesel molecules, CNG, and now hydrogen also. Very recently, we have modified for the hydrogen car.
Fantastic.
Yeah.
Can you tell us a few medical conditions which you have successfully used Indian flower remedies on its own or integrated some of the medical treatments with Indian flower remedies?
Okay, first thing is that this is energy-based remedy, so it can be used as a complementary to allopathy medicine, complementary to homeopathy, complementary to naturopathy, or complementary to Ayurvedic medicine.
Okay.
So it's because the level of effect is different. So say for example, physical is at this level, emotional at this level, mental at this level, spiritual, but our flower is way above. So it can always be used as a complementary.
Mhm.
One, if you want to use alternative to particular therapy, then also our remedies are there.
Okay.
And our main right now is disease we are targeting is for the pain management. We have got excellent results,
Mhm.
and we have. I will explain you about that later. And we are also treating now autoimmune diseases.
Mhm.
Particularly, I'm just recently I have got a breakthrough in sugar management.
Oh, fantastic.
Yes, hypertension and cancer patients. Few cancer patients we have treated without using allopathy medicine and completely cleared for the last 5-7 years.
And reverse the
Completely.
reversal, and they're maintaining their without medication.
Yeah, without
Excellent.
medication for the last 5-7 years.
Excellent. So you've got a lot of props here. Can you explain what these things do?
Yeah, okay. So this is, as I told you earlier, pain management. Now, very common people do ozone therapy,
Mhm.
other hydrogen therapy, all these things.
Mhm.
We have what it's this is the restructured air
Mhm.
in this syringe.
Mhm.
Okay, it's like this, and we inject it
Mhm.
subcutaneously, zero point 0.1 cc,
Okay.
0.1 cc at each point. Okay, so just yesterday also I did it in Chennai.
Mhm.
One patient was having pain in knee.
Mhm.
Usually people will inject around the knee or like above this knee.
Mhm.
I injected only in calf muscle here,
Mhm.
two 2 points
2
only,
points.
and patient pain disappeared. 6-year-old pain disappeared in 4 minutes.
Wow.
And
That's
people was able to patient was able to run. She was a 65-year-old lady.
Mhm.
In fact, she has come for her daughter who had a fractured spine. We treated her also and just injected. She has got fracture for last 6 to 8 years.
Mhm.
33-year-old girl, and we've injected around the spine in the scar of the spine. That's our again specialty.
Mhm.
That we do a lot of scar treatment. So somebody has got, particularly female who has got cesarean
Yes.
scar, which is quite common nowadays. Okay, if we inject, you will be surprised that the migraine headache will go.
Oh, yes. Yes.
Okay, or the knee joint pain. Another specialty which we have done is the TM joint. So we are not injecting into joints at all. Okay, we are injecting TM joint area subcutaneously, and we see a lot of results for any problems in the head area. Not only that, but shoulder area and also in the knee. By injecting here, the patient pain has gone down.
Very interesting.
Yeah, and sometimes it's gone once for all. Like that. Few patients we have to repeat the injections after 6 months or 1 year. That's all. My experience in this injection therapy is for last almost like 7-8 years.
Okay.
And I would say that about 40% of the people I have to inject again. Otherwise, most of the
So
time
60% first time the result is there,
Yeah.
and the repeaters you
Repeat
just
is
one
not-
more injection you do.
yeah.
Okay, that's very good.
So this is unique therapy by injection.
And these are acupuncture points or something related, similar to the.
Not necessarily.
Okay.
Not necessarily acupuncture because I do not know about acupuncture.
Okay.
Points. I know about acupuncture, but not actually the points.
Points. Okay.
Yeah, which are the points which to be.
Okay.
And so I have made my own decision, and then I'm doing. I know Dr. L. Prakash and Prasham. They're all doing ozone therapy.
Yes.
And then portals.
Portal blocks and things.
Portal blocks like that.
Yes.
I have developed my own, and I don't use. Not necessarily I will use.
Okay.
I have used those portals also, and it has given a very positive, favorable results. This is not only for pain only. There are other areas, like indigestion problem is there. Then also we can give these injections.
Okay. But in different areas.
Different area. So one important point I will tell you is that I give a lot of importance to inject in peri-umbilical area.
Yes, sir.
So 4 points, 1, 2, 3, 4.
Yes, sir.
Because according to Ayurveda, there are 72,000 energy pathways coming from here.
Yes.
If any blocks are there in that area, that can cause into disease.
Yes.
Okay. So whatever possible, we try to inject here, and the energy pathways which are blocked, they open up. So patient gets relief immediately. So most of my backache patients, first I treat the belly button area.
Yes.
Okay, and their backache is no, I don't go to the spine area at all. But if required, yes, yeah. Then a lot of emotions are there, which flower remedy takes care, and like psoas muscle at the back is holding lot of emotions. Okay, so if you inject in the psoas muscle area, patient depression will go. They will be very positive. Their back pain will go because the muscle has gone into spasm. Organ wise, if you see, I give lot of importance to gallbladder. Gallbladder also holds the emotions. Okay, so that area, if we treat now frozen shoulder, I would inject in this area. Just one injection this area, one injection in this area. Even the right side shoulder is there, I will inject in both areas.
Okay.
And in 3, 4, or 5 minutes, patient will be able to raise the shoulder without going into that area, without going into the portal.
You are saying there's a lot of emotional connect with the gallbladder with regard to the frozen shoulder.
Yes. This is something a different level we have to.
Yes, absolutely.
And not only that, whatever I'm telling, I give the results also.
And
of course, patients will get that confirms that whatever my theory is there.
So you're treating, and then there's an outcome which the patients are getting better. So then the correlation you are able to make.
Make it. That's right. That's a perfect sentence. Yeah.
Good. Anything else, sir, you would like to share?
Then nowadays a lot of detox program is going on, and in Ayurveda they say Panchakarma.
Panchakarma, yes.
Okay, so we have developed a Neo Ayurveda.
Neo Panchakarma.
Neo. It's I will use little word Neo Saptakarma.
Saptakarma.
Instead of 5, 7.
7.
And in Ayurveda, you say that Panchakarma, you will have to give them something to vomiting, diarrhea.
Yes.
Here we have bypass all these things.
Okay.
Okay. So I'll tell you where discharge coming. From ear,
Mm.
wax comes.
Mm.
From eye, tears comes.
Mm.
So the nose, this. So these three areas we can give. So just because this is a flower energy
Mm.
and not chemical substance, I'm repeating that there is no chemical substance if you do the analysis of this. Okay, flower energy. So you don't have to put into the eye.
Mm.
Just apply externally, or if you are a medical doctor, then you know it. Just apply with the lacrimal gland area here,
Yes, sir.
and patient pricking sensation in the eye will go in 1 to 2 minutes. Okay,
Mm.
that redness in the eye will reduce in 15-20 minutes.
Mm.
Okay, so because it's an energy medicine. Now we want to detox all these things, so you can use this over the lacrimal gland area or over the upper and lower eyelid, over the eyebrows. So this is one detox part of it. In nasal, you can put the nasal drops, and I will show you that is something called fogger, which I'll show you. Then for the ear detox, you just spray over the ear or put one drop in each ear. And in few days you will see the very good detox. 1, 2, 3 areas. Okay. Then belly button area. You put certain gel, oil like that over the belly button area, and you see the detoxing effect. Palm and feet, soles. You put the flower remedies there, and you can put the palm and feet into the water, put the flower remedy into it, it will detox it. So while watching the TV or talking and things like that, just keep it like that for only 5 to 7 minutes. It will detox. Okay. So this is the another rule. Most these are the something which everybody knows about it.
So the Saptakarma is all these things 1, 2, 3.
Yeah, this is a part of Saptakarma.
Yes.
And nobody uses this
Axilla.
Axilla. You put this spray, which is called Deo spray. It will remove the toxins.
Right. Okay.
So this is a new thing which I have used it.
Fantastic.
So then one more thing, little invasive part of it, but that is called as suppositories.
Okay.
So these are flower remedy suppositories.
Okay.
I'll just show you. So these are all medicated. One, you put it in, so you will get a natural normal stool instead of getting diarrhea. Understood?
Yes, sir.
So that is the advantage of this thing.
Fantastic.
Then you can put this flower remedy into your mouth gargling. When you do oil pulling, so if you put flower remedies into the oil pulling, okay, you will be able to successfully remove the toxins like that. So 1, 2, 3, 4, 5, 6, 7, like that.
Excellent. So
the last but not least is this fogger therapy. This is going to be future. Okay. Now I have this is just to show you ashwagandha and cordyceps combination. I've made it into fogger form.
Okay.
So you take like this. You can see here. 7 times I did it. What will happen? Through the cribriform plate, the olfactory will take into the brain straight, bypassing BBB, blood-brain barrier, bypassing stomach, liver, kidney, everything. So straight away it will go in and instantly you can get the relief. Instantly, including mood elevation, everything, like that. So this is going to be a future, according to me, a fogger therapy, which can be converted into fogger form, so you don't have to take it. And particularly people who are very sensitive, any allopathy medicine or the medicine which is giving gastric disturbance or they cannot digest, they get reactions, their liver is not functioning, kidney is not functioning. This patient is going to be answered. This is a futuristic medicine. That much I can tell you. That's for sure. Very fast acting. That's the best part of it. Without any side effects, untoward effect, adverse effect, hypersensitivity. These are not there. In fact, that is not known for last 41 years I've been practicing. I have not seen a single case.
Fantastic.
Yeah.
Wonderful, sir. Thank you so much for spending your time and explaining all
Thank you.
these newer modalities and newer varieties of therapies. I'm sure our viewers will be happy to sort of interact with you. So we will share your details on our
Sure.
screen later. Thank you, sir. Thank
Thank
you
you.
very much.